Welcome to Inspiring Community, an innovative podcast launched by the Windsor-Essex Children's Aid Society. The Society is very aware of the diverse, multifaceted elements of our community that come together to support children, youth, and families as they celebrate success and rise to overcome significant financial, social, and mental health challenges. Host Tina Allen, Manager of Community Outreach, and her co-host Mike Clark reach out to many of the Society's community partners and resource organizations to provide insight and helpful suggestions to help overcome these obstacles. The goal is to provide a practical toolkit for listeners on topics such as managing parenting issues, financial strain, self-care, strengthening relationships, and so much more. The hope is by talking with community experts, listeners feel more connected within a community of support. Join us as we look at new ways to reach for a better tomorrow.
Hello, everyone, and welcome to Inspiring Community, a podcast of the Windsor-Essex Children's Aid Society. I'm Tina Allen, and I'm joined by my co-host, Mike Clark. And today we have a fantastic guest. We have Nadine Manroe-Wakerell, Director of Clinical Practice at the Windsor-Essex Community Health Center. Welcome, Nadine.
Hello, hi.
It's great to have you, and I just want to share a little bit about you before we dive into our interview with you. Since 2019, you've been the director here of clinical practice, and specifically the teen health site, because the health center is very large in scope, but we're talking mostly about teen health today. And you've overseen various programs such as COVID-19 response services for those affected by homelessness, hepatitis C, primary care, youth, sexual health, eating disorders, SAPACCY, mental health and addictions. And you're also the president of the board of WEST, Women's Enterprise Skills Training. So you've had a long career in supporting health services and being such a leader in our community. So can't wait to hear all of what you're doing here at the center. So tell us more about yourself.
Sure. First of all, I just want to say thank you so much for having me here. Was honored to be invited to speak about the work that I get the privilege of doing in serving our community. And so you are correct, Tina. I've been at the weCHC, so sometimes Windsor-Essex Community Health Center will refer to ourselves as the weCHC.
It's a mouthful.
I've been here since 2019, and I've had the privilege of holding a few different portfolios, and supporting different programs. So I've always supported teen health, and previously I also supported our street health location as well as a director there, and was definitely able to see and support the best I could individuals affected by homelessness during the COVID-19 pandemic. Being here at the Windsor-Essex Community Health Center at the teen health site throughout my entire time that I've been here has been pretty full circle for me. I came here as a client back in we're not going to say the number, but I was eligible for services, so I was under the age of 25. And it is just amazing because a number of the medical providers are still the same providers that were here when I was here. Dr. Warwick, for example, and the services still are amazing. I later, after being a client here, had the privilege of being a volunteer at the organization, and then later, like I said, came full circle as the director of clinical practice here. After a number of years working in the community in geriatrics, I worked with Alzheimer's and dementia. I worked in community care. I worked in outpatient clinics. I really have had the privilege of working at almost every developmental stage within healthcare, And then as far as supporting the community, you're correct. I am still the board chair at West, and I do have the opportunity to serve on a few other boards within the community, and it's really been a privilege. So I'm happy to be here to share anything that I can that will maybe provide some light on who the weCHC is, who the Windsor-Essex Community Health Center is, what services we have, and how they could best support those people in our community that are in need of them.
And so in your background, your clinical
nurse.
background is nursing. Right.
I'm a nurse by trade. And then I'm also a proud graduate of the University of Windsor in their developmental psychology department or program. And I have a master's degree in leadership.
Oh, wow.
And then I'm just currently working
impressive.
towards a certification as a certified healthcare executive right now. So I'm pretty
You're busy.
I'm pretty no, but all of everything that I've learned, I can truly say that it has helped me support the community. And just to mention, my master's in leadership is from the University of Guelph. Go Griffins. So I'm like torn. Griffin, Lancer. I once went to a Griffin Lancer football game. And my nephew was playing for the Guelph, and I'm there as a graduate of
You were
both.
on
And
the
I was like, what should I wear? But anyways, yeah.
So can you tell us a bit more about teen health and the services provided through teen health?
Yeah. Oh, definitely. Yeah. So the Windsor-Essex, like we mentioned, the Windsor-Essex Community Health Center, and we'll talk a little bit more about all of the programs within the organization. But teen health in particular serves youth ages 12 to 24. And we provide free services, first of all. That's one of the biggest things to remember. And they can be accessed by someone who has a health card or OHIP or not. So that's something that's really great. It's also confidential. They're confidential services, and we provide the services in person. Some services can be provided on the phone, and some services can be provided virtually. The services that can be offered are medical services. So we offer primary care. So that's like a family doctor. We offer primary care. We offer health assessments. We offer walk-in health services. So we have nurses. We have registered nurses that are here at the clinic or at the site. And someone can walk in and say, I have a concern, and they can receive a nursing assessment. Appointments can be walk-in for nursing, or they can be booked. And if the nurses assess that a physician needs to be seen, clients can see a physician. Our physicians also provide, or our medical services also provide mental health assessments. So we work very closely with the schools. Often when individuals or youth they think maybe there's a mental health concern, they may send the referral over here, and the physicians will do a mental health assessment. Within our medical department as well, we have sexual health counseling as well. So anyone under the age of 25 can come in, so between 12 and 24, and come in and be tested for an STI if they suspect that they might have one, and they receive some education. They would receive treatment. They would receive follow-up. And the same would go with prenatal health, and also with pregnancy, birth control. So those are just the vast depth of medical supports that can be provided will be anything that you could think of that you could receive from your family doctor. And also from like a walk-in clinic type of supports. And if the youth comes in and they do have support from another physician, our medical team works very closely with whoever else they are working with. We also do have collaborations with other community partners in our medical department here. We have a physician that comes here from Chatham that supports youth in gender-affirming treatment. And then we also have a psychiatrist that comes in and works with our eating disorder team on doing psychiatric assessments, consults, clinical rounds for youth with eating disorders ages 18 to 24. So those are our medical. So it's
Right.
a lot of times people don't realize how rich our medical services are, and our physicians have been here. Like I said, they've been here, many of them since 19. They are expert in what they do, and they have such a deep passion and love for the youth. And then we also have counseling services as well. So we're a wraparound. That is the philosophy of a community health center, is wraparound care, interdisciplinary care. And our counseling services include general counseling. And for youth, I also have groups that for depression and anxiety. Then we have specialized programming for those affected by addictions, whether it's themselves or they're affected by addictions in their family. And then we also have counseling specific for youth that have been are involved in the Children's Aid Society. We have a specific social worker for that as well. And then we also have counseling for eating disorders, so specialized eating disorder counseling. And then we also have addiction support workers. And so we've got addiction support workers that support anyone that is contemplating or wanting to talk about their addictions and looking for supports. And then the final discipline that we have on site, because all disciplines and all of the programs across the Windsor-Essex Community Health Center are available to you if you attend any of the sites. So like occupational therapy is another site, but it's available. But the last discipline that is housed here at Teen is nutrition. It's our dietitian. We have a registered dietitian who facilitates groups. She actually even goes over to the youth hub every Monday and cooks meals.
Oh, that's great.
And does nutritional counseling and works with eating disorder clients. And so, yeah, we've got a full gamut of services here.
Well, I shared before we started that both of my daughters access doctors here at the center. And I think that's one of the, I think, key things to keep them engaged in seeing a practitioner on a regular basis is how holistic it is here, how wrap around any of the services that either one of them have needed over the years in their adolescence. And so I know, speaking for my daughters, they feel comfortable coming here. So I guess I have lived experience here as well. Yes.
Yeah. Thank you for sharing that. And thank you for sharing that feedback. Hopefully when the team hears the podcast or even after we're done, I'll let them know how many people's lives have been touched by this program and this site, this organization over the 30 plus years, right?
Are you seeing an increase in numbers accessing teen health? What do the numbers look like?
Well, yeah, we definitely do see an increase in numbers of individuals utilizing the service. We see in the thousands on an annual basis. What we have seen, though, definitely is we've seen a change in why our youth are seeking services.
Okay.
So if we were to go back, let's say in medical, and I had gotten just a little bit of information. If we go back to maybe, I'm looking at maybe 2017. We'll go back. We can get further back than that. A lot of the youth that would walk in for like our walk-in services, for example, were coming in for pregnancy. Now what we're seeing, and you see this recorded through public health, is we see an increase in STIs. Okay. So some of the statistics we have are like in 2017, 2.7% of all pregnancies or live births for women under the age of 20 were under the age of 20, 2.7, which worked out to about 46. Now, what we see let me just reverse that. In 2023, 2.7% of live births for women under the age of 20 was 2.7% of 3,814. So those were births to women under the age of 20. In 2000, so that's in 2023. Compare that to 2017. It was 102. Like it was 102 births compared to the 46 births.
Mm-hmm.
So we see that birth control has increased. So we're not seeing as many live births, so young women having children, but STIs have significantly increased.
Mm-hmm.
And that is something that the public health unit has been talking about. We've heard a lot of it over the last couple of years. Chlamydia,
Right.
syphilis, making a comeback. Like it's so risky behaviors. Youth used to come in for things like pregnancy or come in for more type of situational mental health concerns. What we're seeing now is anxiety and depression has skyrocketed. So rather than coming in for more physical assessments and maybe to talk about some social issues that's happening with friends at school, people are coming in with severe anxiety and severe depression. So mental health assessments are primarily what we're seeing youth coming in for. And I had gotten some statistics around youth are still reporting higher rates of mental health concerns. If we're looking at like they were doing a poll, and what they were finding, if they went even from before COVID to after COVID, that depression in youth went up from 32.3% of the 13,255 youth that they surveyed, from 32.3% before COVID to after COVID, 40.3%.
Wow.
And anxiety went from 33.8% before COVID to 36.4%. And so that is something else that we have seen significantly change. And then the other thing that we've seen significantly change in youth over the years is eating disorders. Eating disorders are, I think at one point they called it a tsunami during the COVID-19 pandemic. And so we're seeing more eating disorders because of mental health. We're seeing also more drug use, and then we're seeing more STIs. So this experience of our youth is very different from their experience 20 years ago.
Oh, for sure.
And
I'd like to come back to this to talk about, what's ultimately needed in terms of prevention. And is it education? Is it more services? Is it more an infusion of money into the system? There's so many factors, but we'll come back to that for sure.
Nadine, I just have to say it's such a pleasure being here with you today. And what you've already offered us is just such a wealth of information about resources. It's just enlightened me. And we're only a couple questions into this podcast. But to get a little more specific about one of the programs here, can you tell us more about the substance abuse program for African, Canadian, and Caribbean youth, SAPACCY?
Yeah, definitely. So SAPACCY is a newer program here in Windsor. But back in the 1990s, early 1990s, there was in Toronto area, there was let's call it an epidemic of incarceration, substance use, and violence amongst Black youth. And we have to remember there were a number of Black youth that were emigrating from other countries that were in the GTA. And we were seeing poor outcomes in schools. We were seeing, again, like the higher incarceration rates, mental health issues, and crime in communities. And so a group of community members came up with this culturally responsive mental health and addictions program for Black youth. And the program was created by Black people for Black people. And the program is facilitated by Black people for Black people.
Okay.
So they did this in Toronto because statistics do actually show that individuals will be more responsive to care if the care is being provided by someone that they have something in common with. And when they did do the research around Black people for this specific program, they identified that, and a lot of literature has identified that, because culturally, and you'll see this throughout many cultures, many people that are of a minority group, they will code switch. So they talk one way when they're amongst their group, and then they will talk another way to be accepted by the majority group. So you could even compare this to women. You get a group of women together and they might talk a certain way. Mm-hmm. And then when a man comes around, they might change the way they talk, right? Because they don't want to maybe seem a certain way. They want to do that to be accepted and to adhere to the norms, right? So we do know that when we're under stress or we're having a challenge with something, that we will revert back to the way we normally talk. And there was already a significant, and there still is a significant stigma around mental health. So individuals not only feel there's a stigma culturally to talk about mental health, because maybe it's spiritual, there's something wrong with you, we don't talk about it, it doesn't exist in our community. And then on top of that, you have to talk to somebody who doesn't understand the way you talk, or doesn't understand your culture, or, that kind of thing. Mm-hmm. When you use phrases, they might misinterpret them and call protective services, but it's just a saying. It's just a saying, My mom's not really going to kill me. That's just what she said, mm-hmm. that kind of thing, right? And so this program was put in place, and it operated for 20-something years. And then during COVID, where we saw at the height of, movements around anti-Black racism and more equity, diversity, and inclusivity of the health services and substance use. And again, just like we saw eating disorders coming up, we were seeing these statistics within these different communities that all kind of trickled mm-hmm. up. We saw that with the homeless population. You started seeing the conditions. COVID, it's like COVID took the veil off, and we all saw the inequities even more so mm-hmm. in the community. And so we saw this in the greenhouses, for example. You found out that how many people were sleeping in a one room, and COVID was overrun there because of the living conditions, and then there was more awareness. COVID kind of lifted the veil to some of these things. Because all the other noise had stopped, right? So during that time, the ministry funded 7 more sites of SAPACCY. And so SAPACCY we started SAPACCY here in Windsor. So it's in Windsor, Ottawa, and then Hamilton, Kitchener, a number of sites in the GTA, and they're still looking at expanding. So it's a culturally responsive mental health and addictions program for Black youth ages 16 to 29. And it goes above the 24 because the research has proven that Black youth, if they even seek mental health supports, they will seek mental health supports later. And then mm-hmm. by the time they seek it, they've already aged out of the system. Mm. So this program goes up into 29. And so that's the SAPACCY program. It's
do you see most organizations referring youth to this program, or are they coming on their own, or is it mostly a referral base from other partner organizations?
So the interesting thing is, mental health is such a stigma in the mm-hmm. in the Black community that the first year and a half was really spent in increasing awareness of mental health and trying to break dispel the myths. One of the things about the SAPACCY program is it's an Afrocentric approach to mental health. So what it does is it's inclusive of the family unit mm-hmm. because in the Black community, it's very difficult to separate the client from their family. And then mm-hmm. how do you define the family? And often some of the resistance in youth seeking services has been I can't put my family's business out there. Right? Like, we already have enough issues. Nobody needs to know that this is happening. And so we spent quite a bit of time educating families and caregivers and leaders in the community and the church and just groups of people about mental health. So in the beginning, most of our referrals that we saw were coming from youth coming to see us. I can't tell my mom that I'm, but this is how I feel. And research has already proven that Black youth have like some higher rates of suicidality. Like, these things are happening, but they're not asking for help because like it progresses to such a point, that it's not preventative. So in the beginning, a lot of it was like word of mouth. And so we would have events and things of that nature. And then we would talk about the services. We'd do psychoeducation, and then they would sign up. What we're seeing now, after getting the word out to organizations like yours, right? You guys have been great, CAS. Right now we actually have a formal agreement with the Windsor-Essex Catholic District School Board. We have agreements with the Youth Hub. We're out in the county. We're seeing a lot more referrals. So like the criminal justice system, they are sending referrals. This is a part of their process. Schools are sending referrals. It's so we're seeing more referrals that are coming. And it's only been 2.5 years.
Wow, 2.5 years.
Yeah, like it hasn't been that long. It was May 2022. So this May coming up will be 3 years. Yeah, and it's an Afrocentric approach. It's a strength-based approach because so many, and you'll hear it, so many Black youth feel that their skin color is a deficit, right? Like I kind of got the short end of the stick. Like, honestly, a lot of them will communicate that way. And so with that, it kind of impacts their self-idea and their ideas of themselves, and then racism, and then there's discrimination, and then you hear all the stories of the things that have happened to them, and so we come from a strength-based. So it's helping them acknowledge and appreciate who they are and the resilience that they have and what they've overcome, and builds on that. So it's an Afrocentric approach.
Right.
So yeah.
You have been so involved in the community, and you can you see some of the things that are probably associated with the crisis as it relates to our youth today. So as a healthcare leader and advocate, what concerns you most with the youth population in Windsor-Essex and the issues that they are facing today? Since they're so complex, multifaceted, how does one go about that? I know you said that you're a very holistic environment, and it's a wraparound type of approach. So how does all that fit together? Yeah,
I think just like to go back to the first piece where you made mention about like kind of what like maybe alarms me, or like what have I seen?
Right.
The early age of youth coming in and seeking services that are experiencing some significantly complex issues. So human trafficking human exploitation is a thing that we see youth affected by. Intimate partner violence is something that we see. Substance use is something that we're seeing. Homelessness is something that we're seeing. Significant mental health concerns is something we're seeing, and we're seeing it at a younger age. We're seeing like 15-year-olds with like all five. So that really alarms all of us, and the ability to be resilient and to have the supports in place to address those needs is a challenge. So although we're holistic, something that we would like to see is earlier intervention. So how can we work with schools a little bit differently, or how can schools identify some of these things differently? And so we're happy about some of the partnerships we have. But, from an identification perspective, that's something that there needs to be more eyes on.
I absolutely agree with you on that, because I think as a community, we are proud of the fact that we have teen health. We have the youth hub. We have many services and supports in our community for young people. But I know even having teenagers, they have to want to access. They have to. So if we can prevent them from having to make that decision of whether they risk their reputation or, speak to an adult about something because they don't want to speak to mom, if we can prevent that, if we can back that up and do a better job of awareness, those really building in that resilience, I absolutely agree with you. But how do we do that? And what do we do?
And I guess...
and whose responsibility, right?
To add to what Tina's saying, where does this all come together in a home? Like, obviously, it's a major issue for the youth, but for the entire family, it is a very complex issue that everybody is dealing with in one way or another. So how do we as a community take care of everybody in that home? And so they can support each other, but yet feel supported themselves at the same time.
Yeah, there's some. So you bring up like really, really good points, and I brought some resources about some of the programs just to kind of talk about some of that. So this comes up at a really good time because I was hoping to get an opportunity to talk about that. I guess the first thing is we talk about the homes and whose responsibility is an identification. Primary care does play a role in that. The research shows that 70% of people in general, they will first communicate an issue regarding mental health to their family doctor or to their physician. And so that's really important that people are on a regular basis accessing primary care and accessing services in a proactive way. So like, getting physicals and doing all of those kinds of things and going to the doctors and getting checkups, because then you begin to have access to you get navigation and you get access to services in general, right? So I always thought that was a very interesting statistic. And when we had done some work with CHIO in Ottawa, and they shared that, it's so true. When something is wrong, you usually will go to your family doctor first. So that's one of the things that we promote and that we advocate for, is that there's more primary care in our community. And that's one of the services that we do provide, is primary care. So someone may not think about walking down the hall to social work or the dietitian or to whomever, but they will tell their family doctor, and then their family doctor will, what about this? What about that? You know what I mean? So it's kind of like there's a piece of taking care of yourself before anything goes wrong that we have to promote, within our homes. Taking care now, when it comes to caregivers, for example, right? Like the families, one of the things that I remember experiencing and seeing, and we see it here as well, is the burden. I have to say, I don't want to use the word burden, but the challenge of caregiving for someone who's going through a difficult time. So whether it's someone with dementia, or it's a youth or someone with an eating disorder, for example, there is a significant impact on that person psychologically and physically. I remember Kai putting out a report maybe around, I can't remember, maybe it's around might have been like 2015 or 2013, 2015, and it's probably still out there, is that so very often when someone is suffering from an ailment, and dementia was what they were talking about in particular, the caregiver can often pass away before the person that they're caring for. So one of the things that we offer here at the CHC are caregiver support programs. We have one program in particular. It's called, because what you're talking about happens all the time.
Right.
And so what happens when the individual that is providing the support doesn't get the support they need, they can't support the person they're trying to take care of. And a lot of mental health concerns are hereditary. Like sometimes that's one of the predisposing variables, right? Is that genetic component. So
and
they're
even
dealing
the whole
with
burnout factor that
Yeah.
comes with being a caregiver. Yeah.
Yeah, so one of the programs, so I brought these for you guys so you could take them home. But one of the programs that we do offer is the two of them actually that I think are pretty much related. One is called Powerful Tools for Caregivers. And this is a program, it's a 6-week series of interactive groups that help caregivers learn to care for themselves while they care for others. Because it's like that's right, it's a real thing. Like you can't take care of someone while you're burning out
Exactly.
and you're stressed yourself. And then the other program that we offer, this one is really, really cool, is Master Your Health. And it helps clients to work with improving their mental and their physical wellness. And a part of this program as well is helping you know how to ask your primary care provider questions. You know how sometimes
That's great
you're like,
Right.
you almost feel intimidated.
And you feel rushed.
Yeah. Yeah.
You feel like you should only deal with that one topic, that one question.
And so, like, you have to be ambassadors. You have to be ambassadors for yourself. Like, you have to advocate for yourself.
Absolutely.
And so these programs help to support you in kind of knowing like what to say when you go to the doctors, what kind of questions to ask. And then when you are a caregiver, like, how do you take care of yourself? You know, like you always say, you can't take care of anybody if you're not, like, what is it? You can't put water in, I forgot the saying.
You can't, fill from an empty cup
Yeah.
or something like that.
Yeah.
We get it, yeah.
Yeah.
It's true.
So
It's
yeah.
true.
Yeah.
So those are, different strategies that caregivers have to put in place. We even have some that we're starting to roll out a recovery care program with eating disorders. For caregivers, it's online modules for caregivers and individuals affected by eating disorders to increase their awareness. You know, eating disorders has the highest mortality rate of any mental health disorder.
No, I did not know that.
It's, there's the highest mortality rate. And so then people start getting starving brain and they are not thinking straight and they actually believe that they don't look like what they look like and someone else is trying to convince them of that. It's a very difficult situation to have to deal with that every single day. And so, caregiver supports, it's really important. So and also peer support. So finding individuals that are going through the same thing that you're going through, in order to connect and know that you're not alone is really, really important.
Very valuable.
Yeah.
Anyhow, great resources.
Yeah. So we've talked a lot about what happens here at the center. We've talked about some of the other programs in our community. Do you think our community collectively is doing enough to meet the needs of young people in particular, to help them with all of these factors that they're dealing with?
Yeah.
Or what more could be done?
I think in my experience, I believe that everyone is working to the best of their ability. But one of the biggest challenges that we hear from families, and I've seen over my years in supporting this youth population, and even in my own lived experience, is wait times, and then also not knowing what's available. So I think as a community, and this is something that healthcare providers have identified and are working towards is being more coordinated and being more being more streamlined, having pathways. Services may change from location to location. Phone numbers change. People don't know, people didn't, I bet there's some things I talked about here today that you didn't know about. And these services have been here since, 1904, not really 1904, but you know what I mean. But they've been here a really long time. And you don't know that a service exists until you need it. And then when you need it, sometimes you don't know where to go. So I think we need to be more coordinated, people need to know either you call one number and you get all the resources, that kind of thing. But we still do not have, because we've seen, like we talked about, complexity in mental health has increased. The comorbid coexisting diagnoses are on top of each other in youth. Like you see more and more issues within one single youth. We don't have enough mental health supports to provide long-term supports. So, we have a number of short-term supports available, but when someone comes in with complex trauma, they need service for a very long period of time. And our system isn't equipped to help someone.
Intervention.
It's usually short-term intervention. And we all recognize that. Like, that's something that is a gap for our young people. And so long-term intervention, knowing what services are available, ensuring that people are educated about what's available to them. Like we have a crisis line, right? That's available 24 hours a day, 7 days a week that someone can call, right? We have the mental health supports available at Windsor Regional Hospital near their emergency department, down at 500 Ouellette. Many of these services are available 7 days a week. We have children's crisis lines available at RCC, in Hotel Dieu. We've got all these services available, but often when someone's in a bind, they just don't know.
Right.
They just don't know.
Or they're met by those wait lists. They have to wait for service, and that's an issue. Beyond that, we know that the social infrastructure is very much a challenge, an issue for many of us, from food insecurity to housing and all of these factors. Do you see that, is that a presenting problem with young people as well? There's the personal, familial, those challenges that they're dealing with, but you can't ignore what's going on outside of them. And obviously, if a caregiver, for example, is concerned about having a roof over their head and feeding their children, it's really hard to be in the best place for yourself as an individual, let alone as a caregiver. So are you seeing that come through? Okay.
Oh, most definitely. So those social determinants of health. So food insecurity is a reality for our clients that are affected, that have a lower socioeconomic status. But that definition is changing. Like, you could be middle class and still having issues with, food security. Like, honestly, go to the grocery store and how many people are buying fruits and vegetables? So nutrition, it all just trickles. But food insecurity, how can you focus on your mental health when you're hungry?
Right.
So
you're learning, education,
or anything. And so you make, those are all very excellent points and very, very valid. If I open that cupboard down here, we've got snacks in there. We have youth, and we also offer bus tickets. We've got youth that actually come in, may not have money for bus fare, so we offer them a bus ticket, and then they haven't eaten all day. But they recognize that they need to address some of their mental health concerns. So there you go, where that barrier of socioeconomics, where food plays a role. So families are focused. They're not focused. They can't, because they have to go to work and they have a couple jobs and they have to do this. And then the kids are by themselves. And then when they're by themselves, what we're also seeing, and our physicians will speak to this, and they speak to it all the time, the impact of social media, what it has had on mental health. So they're maybe, unsupervised, or social media plays a role, the computer plays a role in their social interactions. And so then there becomes addictions to that, and what that does with body image and mental health and attention span. So so we're seeing a lot of these environmental factors having an impact. So yes, socioeconomics plays a role. Food insecurity plays a role. We have many youth that come in here hungry at the end of the day. Hence, the Youth Hub's cooking class on Monday nights is so popular, not only because they learn how to cook, but they also get a meal. Right? Which is great. And I'm not saying that everyone that goes there for the meal, but it is an added bonus to have access to food. Technology is another thing that many people do not have access to. Not everyone has data or Wi-Fi in their house, and they may need it for their homework. Not everyone has a cell phone. We have had youth in the past who did not have access to cell phones. And when we had the COVID-19 pandemic and everyone had to have their appointments over the telephone, they were significantly disadvantaged. So we have had a phone lending program. So technology is another variable that impacts people's ability to be healthy. And they actually do have statistics on people that do not have access to a phone have poor health. Wow. And so we see food insecurity, we see technology insecurity, we also see transportation, people not having access to transportation. And all of those things do play a role in their ability to be well. And so the solution is not just about the mental health services. The solution is about those social determinants of health. So it's so much broader because if you want to go upstream, if you want to go earlier, more in the process of how some of these mental health issues present themselves and physical issues present themselves, it's because basic needs are not met. Maslow's hierarchy of needs, right? Those basic needs are not met.
We're so used to responding to disease and not health, right? And that prevention piece, and we hear that over and over with our podcasts. It's the same challenge that we face. It's like, how do we turn that around? How do we, when the systems seem to be struggling the most, where resources are even less, financial resources in health, in education, and child welfare, that how do we turn that around? So in talking about all of the amazing work that your center is doing, and who can access, can you recap how individuals can get in touch with you or come to your center, where you're located, anything that could help break down that barrier for access?
Yeah, most definitely. I just before I say that, I just want to go back and let you know we do have health promoters, and they do social prescribing, system navigation. So someone can get a referral to the organization, and the health promoter will help to do that navigation.
Oh, that's great.
For them. But in order to access, let's say, teen services, you can self-refer. So you can walk in, you can call, you can go online, you can complete a registration form and bring it in. You can be referred by a healthcare provider. You can be referred by your school. It's any way. Like it's actually quite simple. I mean, like I said, you can walk in, you can call, and you will be registered. Someone will call you. They will make an appointment for whatever service you're looking for, and that's
great.
And we'll that's how it works.
Yeah, we'll make sure to put your contact and your website, phone number,
definitely,
and all of that in our show notes for sure.
Yeah. So obviously, you're a champion for youth, and I'm sure you are personally, and as well as your organization. But, getting back to that age-old sort of adage, it takes a village.
It does.
So when it comes to advocating for those struggling with mental health and addictions, what are the key priorities for your organization? And what is the message you want to send to our community and our government? What more can be done? How can they help? How can they support?
So if I were to there's so much in that, right? But if I were to like sum up kind of what we would want to convey to our community and to our government, is that these youth are our future. Mm-hmm. Like, they're our future.
Absolutely.
And when you think about everything that they have gone through, whether it's the pandemic or what the access to substances, the violence they've witnessed, the impacts of social media, I really do think that our government and our society in general needs to take a step back and reevaluate what we think is assisting our youth in being successful. Mm-hmm. Whether it's from a technology standpoint, I know there are some schools are now pulling phones back and things of that nature. Whether it's access to after-school programs. I don't know about you, but I had home ec and I had shop, mm-hmm. and I had programs available to me to help me build the resilience and to give me access to peer support, coping mechanisms, and things of that nature. I really do think that we need to step back and take a step back and reevaluate what we have in place right now. Is this what's best for our youth moving into the future with all of the data and information that we have?
Mm-hmm. Well said.
And I would encourage anyone that's in politics, or anyone that's working in an area where they're funding youth, to take some time to get to know the youth. So I really do strongly always encourage that we have patient or client and family advisors a part of all of the decision making that we're making, mm-hmm. to support our youth. And that would be, and I mean, I think, and then the final thing would be is when whatever we're doing in the community, whether it's settlement agencies, lead programs, or it's universities offering, or colleges offering employment programs and training, or it's a primary care provider, so it's a solo physician in their office, is to just remember to see the youth as a whole, and to see them as not their diagnosis, but to see all of those things that you talked about, mm-hmm. Tina, when they look at a youth, mm-hmm. and when they're treating them, and to ask the right questions.
Mm-hmm.
Okay. So, having said that, Nadine, now, if an individual, an organization, a business wanted to support the work that you do, either financially or from a volunteer perspective, mm-hmm. what are some of the opportunities that might be available to do that?
Well, I would say, from a support perspective, our organization really stands very firm on primary care. So from a funding perspective, or opportunities for partnership, is to increase the amount of primary care, because primary care is going to help to identify the issues that need to be addressed. From a resource, like a volunteer perspective, we definitely do accept volunteers. We accept volunteers for our events. We accept also students. We always say, go out to your placement office. We have students that are with us, because capacity building is really big for us. So we're always willing, and when we can, take on students so that they can take the information that they learn and go out into the world and to share that in every corner that they go to. So capacity building is really big for us. And if there are organizations that want to help us, promote the work that we do, we would definitely love that as well. So, yeah.
Well, this podcast is one way of doing that. Hopefully we have.
Hopefully that helps you.
Hopefully we have a big audience for it.
Yeah, that would be great because, like I said, we've been here since 1904, and and I bet a lot of the things that I said you haven't heard.
No, you
haven't heard of before. Yeah, and so that's what we're hoping. That's what we're hoping. And again, just to just want to reiterate, we have so many sites. We have our teen health site that we were primarily talking about today. And then we have our site closer to the downtown, our street health site, which will soon be moving actually onto University, that supports primarily the downtown core. And then we have our site on the east end on Lausanne Parkway that provides primary care. And they're the ones that specialize in diabetes wellness, and the chronic disease management, and also well-being, physical well-being and exercise for older adults. And then we also have our site on the west end on College, our Sandwich site. And we also have with our diabetes wellness and chronic disease, we have respiratory services. So if you have COPD, chronic diseases, they support that. And then we have our site out in Leamington to support the county. And then we have weekend clinics at the greenhouses to support those individuals, those agricultural workers. So the people that we provide our service to everyone, but that wraparound that we provide really sincerely benefits individuals who have the most barriers, that they can't go here, and have 6 different referrals, that they can get all of the services in one place. And
you've definitely evolved over time to meet the changing needs of our communities. So thank you for that.
Yeah. Thank you.
Any other thoughts? Any other comments? I know there's so many programs that we didn't get a chance to touch on, but anything, any final thoughts?
I think that we're stronger together.
Absolutely. We're
much stronger together. And so I'm not a Windsorite. I guess I'm now a Windsorite. I don't know.
There you go. You're adopted.
I'm adopted. I hail from Toronto, and I'm a Windsorite now. And this community really embraced me when I came. It was just me and my son, and that was it. And now we have community. And I know that in the time that I've worked in healthcare, and in the time that I've been here at the CHC, we have so many amazing partnerships with, organizations like BANA and Windsor Regional Hospital, and we have the Youth Hub, and we have the Bridge in Leamington, and there's so many organizations, like I mentioned, the Catholic District School Board, people can access services, because when they access those services, then you know what I'm saying? So that is, if I were to end with anything, is that we're stronger together.
Right.
Even Brentwood, there's so many organizations. CAS, I just got an email while I was here, seeing another email from CAS about more opportunities for partnership and collaboration. And if it is a community, we have that mindset that we look around when we're planning. Is the patient here? Are families here? Are my partners here that could help to bridge gaps? I think we would find ourselves in a better place, because unfortunately economics aren't that great. We're not always going to get more money. We're not always going to get more money.
And I think to that point, that those who are in our community and who are struggling, who are suffering, they need to know they are not alone.
Yes.
That we, as you say, we're in this together, whether service providers working together or individuals, that we really need to move forward with compassion for those around us, because I don't think I think people are so caught up in their own situations that maybe they don't see it, or for whatever reasons, not really embracing each other the way we could, short of everything else that we lack in our community resource-wise. Why can't we just all pull together and support where we can? So thank you for all that you do, and thank you for being on our Inspiring Community podcast. And I think that's a wrap.
Thank you so much, Nadine. It's been a great pleasure. We hope to be able to promote your services as much as possible. And the collaboration between the CAS and your organization, we value that, and we will for years to come. But I've learned so much today.
We're so grateful. I'm grateful. Our organization's grateful. Thank you for having me. And yes, if even one person hears that they're not alone and that there are services, then we will have, hopefully we'll have done met our goal, right? Is letting people know what's out there for us. So thank you. Thank you so much.
Take care.